Recording in progress.
Hello and welcome to today's special event with eLotus. We have been hosting educational courses at eLotus for over 2 decades, and we are proud to be your trusted source for premium CEU content. With over 250 speakers, 900 courses, and 3,500 hours of continuing education. My name is Donna Chow, and I'll be hosting and moderating today's class. We are happy you can join us today. We are excited to present today's webinar on allergy, sinusitis, and psoriasis, Dr. Jimmy Chang's Master Herbal Sheet with Dr. Jimmy Chang as our distinguished speaker. Dr. Chang is one of our top instructors out of 250 people that have presented over the past 20 years on the topic of herbs and pulse diagnosis. Our sponsor for today's webinar is Evergreen Herbs, who has been exclusively supplying Dr. Chang with herbs for over 25 years. Their commitment to quality and service has made them the ideal partner for Dr. Chang's clinical practice and research, and we are honored to have them as our sponsor for this webinar. Today's webinar will be held from 2 to 4 p.m. Pacific time. And before we begin, let's ensure that we are all set up for an engaging and informative session. For the chat room, please set your chat preference to everyone so that all attendees can see your messages and join the conversation. If you have any questions for the instructor, please type them into the Q&A box. And then after the session, a quiz will be available the following workday, and we will send an email notification once that's ready. Our speaker today is Dr. Jimmy Chang, a doctor of Oriental medicine trained in Taiwan and a licensed acupuncturist in California. He has over 40 years of concentrated clinical experience treating over 500,000 patients and applying his expertise pulse diagnosis, and herbal prescription. In today's class, you will learn the tried and true formulas from Dr. Jimmy Chang, the master of herbology, as he explores the art and science of his unique combinations. You can also learn the pulse indications for these specific conditions and how to prescribe a unique herbal formula for your patient. Dr. Chang previously taught a number of courses for us, which are now available as distance learning CEU videos. If you want to be able to diagnose a patient's pulse, identify Western medical diagnosis, and create clinically effective herbal formulas, Dr. Chang is the person to learn from. He will help you improve your pulse diagnosis and herbal skills. To learn his pulse system, we recommend the Gold Pass membership. Your yearly membership gives you unlimited access to his foundational pulse courses and herbs prior to 2020. And with the Gold Pass, you can also try the herbs he mentions because our sponsor, Evergreen Herbs, will provide you with an herb voucher worth the price of the Gold Pass. There really is no better value if you're seriously thinking about learning herbs and becoming proficient in them. To learn more, I'll post more information in the chat room. For now, let's get started with today's class with a quick overview of how Dr. Chang uses herbs, because we do have some new students with each class and we don't want anyone to get lost. If you are a longtime student of Dr. Chang, please bear with me as I quickly review this information, or feel free to step away for 5 minutes, do some qigong, and get some tea. Dr. Chang's herbal style differs from the traditional method that we all learned in school, and he also only uses extract powders exclusively with evergreen herbs. Now, evergreen, they carry approximately 300 single herbs and 100 formulas, and Dr. Chang's pharmacy has 150 single herbs and formulas combined. If you're curious about his pharmacy, a link to a YouTube video is included in your lecture notes. By the end of today, if you're interested in starting a pharmacy like Dr. Chang, Evergreen Herbs has a special webinar promotion to have the essentials of Dr. Chang's pharmacy at 15% off, which is the webinar discount. So I'll post that link in the chat room for you in just a bit. Also, you can check your lecture notes for details and contact Evergreen Herbs, or chat with us for more information. All right, so the formula evolution. Dr. Chang creates his own formulations that he frequently uses in his practice. He usually names the formulas after what it's used for, and these are more recent formulations, which may change as he sees more patients and modifies them accordingly. Whenever he updates a formula, he'll add 2.0 after it. So you'll know that there's a version 1 and a version 2. So next, what is Fang Jia Fang? If you're unfamiliar with the concept of Fang Jia Fang, it's the combination of different formulas to yield a better effect. It's possible to do it with raw herbs or extract formulas. Each evergreen's extract formula is decocted and extracted all together at the same time. It's not combining 4 different single herbs once it's already extracted to make a formula. So the idea behind Fang Jia Fang is to use formula plus formula, not all the single herbs together. This is like eating soup where all ingredients are cooked together versus eating at Chipotle where all the ingredients are added together to make a final product. If this doesn't make sense for you, Dr. John Chen has a video explaining Fang Jia Fang in greater detail to help you understand the concept. So check our YouTube channel for that. Dr. Chang prescribes herbs in 100-gram bottles or 150 grams if the patient is not local or it's a chronic condition. So the bigger bottle allows the patient to receive a discount on herbs too. For a 100-gram bottle, he prescribes 3 spoons 2 to 3 times a day. So how do you read Dr. Chang's prescription? All right, so if Dr. Chang lists a few herbs and then a number at the end, that means all the herbs before that number is at that percentage. For example, let's use Dr. Chang's Sleep Combo 2.0. It has Suan Zao Ren Tang at 40, Yi Jiao Teng, Huan Pi, and Zhi Tong Yin at 20. Can someone please tell me how many grams is Zhi Tong Yin? Go ahead and type it into the chat room. All right, so the Sleep Combo 2.0, let's say it's 100 gram total for the whole thing. 40 grams would be Suan Zao Ren Tang, which means there are 3 herbs left, Yi Jiao Teng, Huan Pi, and Zhi Tong Yin. And if I'm doing my math correctly, that means each one is 20 grams each. Did you guys get that too? Awesome, great work. Great, next, do you have to mix the herbs yourself? You certainly can. Some formulas such as circulation sanjiao and astringent herbal ABX have already been pre-mixed as the collection formulas over at Evergreen Herbs. The collection formulas is Evergreen's proprietary line. And many of the new formulas are not pre-mixed yet because Dr. Chang is still tinkering with them, still customizing them. So feel free to mix them on your own or use Dr. Chang's formulas as a base to create your own formula. And that's it, you guys, for my very short intro. I hope it was informative for you. Let's go ahead and welcome Dr. Jimmy Chang, who will take over from here.
Still mute. Okay, hey guys, this is me again, Jimmy Chen. Today I'm sorry about a little bit delay, but I'm going to talk about something very interesting: allergies, sinusitis, cirrhosis. This psoriasis. This is a very difficult skin problem to treat. Very difficult and very severe. But the good news is that this the formula is kind of very useful, huh? But we're gonna start with the allergy and stuff. We're gonna share with you something pretty new. I believe you'd never heard it before. Okay. The beautiful lady Donna talked about the Fang Jia Fang. Jia means plus, Fang means formula. So my combination is always the combination of several formulas put together to get a better results. Okay. You can find my formula collection in Tina's website. It's very clear over there. Okay. Now let's begin. First part is the allergy. Huh? So usually we do not see too much on on the ear, but I can show you this. This is the area for allergy. If you see some redness there, then it's allergy. And this is the respiratory system. Never mind is the lung, bronchi, or the nose, something, but this is the chest area. So if you see some darkness in there, that means blood stagnation. And usually this area is red, and that's the allergy. But for this ear, for example, see the spot? That's so-called inner ear. That means there's something dead blood in the inner ear system that will cause vertigo. And this type of vertigo is blood stasis. Usually we treat vertigo with some 半夏天麻白术汤, 龙胆泻肝汤, something. But this one, you must add some blood movers. For this groove here, that's the heart, ischemia. Maybe this guy is suffering from some kind of a murmur in his heart. And see this part there, that's the chest. If it's a lady, then something in her breast. Be careful, huh? And this grooves, this line here, that means insomnia. Sleeping is no good. And see the dark spot here? That's the kidney stone, for your information. And this one, oh, I mean, no, not this one. This area is the thyroid. It's not too bad. Okay. Let's get on with the allergy. First, you must get yourself one of these. This thermal temperature gun, the infrared, because I want you to measure the temperature of your patient. First is this two area, here and here. The difference, most of the time, this area is freezing cold, and this area is pretty hot. Or they are equally freezing cold, or hot, Sorry. So that could be several combinations. For example, if this area is cold and this area is cold, we can touch it with your fingers if you want to. Then we might use something warm to build up all the circulation in the nasal area to help the patient to fight against the cold wind invasion from outside. If one of them, then we'll have to use a little bit of warm medicine like 桂枝汤, 葛根汤, something like that. Or if this place is hot and this place is cold, or this place cold, hot, and this is cold, that means the imbalance in the human body. Again, we might use the 桂枝汤. Sometimes we must use the most popular, most useful formula, 小柴胡汤, to balance the cold and heat and inside and outside. So if it's all hot, that's simple. We can use only, you use my US1 and astringent complex, or just simply ABX, something to clear the heat. So I really suggest you should have one of these prepared in your office, the thermal gun, infrared. It's very easy. So most of the time, this area is cold because it's facing the outside wall, and this one supposed to be a little hot if the patient is strong enough to bring more the blood circulation to the face. The human face, the 6 channels passing through the whole face, so it's supposed to be most powerful, most thick defense line of a human body. But the nose with the openings can be dangerous, can be weak, because it had direct contact with the outside air. So we must find out the temperature here and here. Okay? Sometimes you should find something here, the temperature here in the yin tongue. There's a somewhere. I don't know the number, but here, if it's too cold, be careful with your medicine. Sometimes even you can use a 四逆汤. 四逆, 四 means forward, 逆 means backward. 四逆汤 is the hottest, very hot formula I ever used. Even now is summertime, but still, you know, people sitting in the air-conditioned room too long, the temperature is too low or something. This area can be cold and defenseless. So we might use something to warm it up. So the nose will be have more blood circulation and more temperature to fight against the allergy. Okay. As for the formula, okay, this is the first condition, huh? The first one is the right cun. Let me use this word. The right cun is strong, and the right shi is long and wiry. The right cun floating here. Not floating means when you touch, this is the surface. When you touch the surface gently with your index finger, and this is number one, cun, huh? So you feel the strong rebound, strong jump. That means that this is the place for Tai Yin. So that means the surface and Yangming and Da Chang and Long. So there's, in other words, this area refers to the surface condition. In this condition, this is floating and strong. That means surface heat. And right chi is here. Actually, cun, one, chi. Actually, it should extended all the way toward the heart. So this could be the long and strong and Taiyang. This is Taiyang pulse. Taiyang means meridian. The Taiyang is small intestine and bladder. The Taiyang pulse that covers the entire neck. That's the entrance of the cold wind into the human body. But Taiyang, the pulse is strong, but sometimes it means coldness. Coldness needs your advice to tell the patient what to do and what not to do. So in this case, I designed a combination which is very useful. First is the Wai Gan 1号, number one, external wing number one. Is for everything from outside, because actually, I know it's the summertime, it's supposed to be very hot, but not this year. But anyway, people into the air-conditioned room or in the northern part is cold sometimes. And most dreadful things, they don't blow dry their hair after shampoo. They let it dry, especially ladies with long hairs. That's a very bad habit. And in the Qing dynasty, there's a very big volumes of books talking about medicine or something. The number one is called head wing. So what is head wing? Head wing means because in Qing dynasty, we don't have any hair blowers. So they have to leave the hair dry in the air after they do the shampoo. I don't know how they shampoo it, but they have no way to blow dry it. So leave it dry. But in wintertime, the cold wind were invaded into the head and causing headaches forever. The head wind problem will cause headaches forever. And most dreadfully thing is the ladies, after giving a birth, in Chinese tradition, we ask the lady to stay warm and do not wash her hairs for 1 month. The reason is just to prevent the possibility for the cold wind to invade the lady's head. If she didn't blow dry her hair after shampoo, the cold wind into her head, the headaches will be there forever. So that's very dangerous. So the cold wind can be so invasive. So I invented this combination. It's very simple. 外感, 外 means external, 感 means feelings. So actually it's called external wing combination, whatever you like to call it. It's combination of 银翘散 and 葛根汤. 银翘散, 银翘, 银 means 金银花, the rest of them are cold medicine. So cold medicine is good for the strong pulse here, for the inflammation. And the 葛根汤 is the most useful formula you must have it in your pharmacy. 葛根汤, in California, we're not allowed to use ma huang, but some other areas, some other part of the world, ma huang is permitted. So if you have ma huang in your 葛根汤, then you're very lucky, because ma huang can be very useful for expelling the cold wind out of the human body by giving some sweat. So we don't have it, so fine. Okay, let's do it. 葛根汤 is the most fast relief for the neck pain, not only for the wind, also for the bad gestures, for the bad conditions. Once I was treating a dentist. He suffered from the neck pain because he needs to move his arm to do the stuff in the mouth. But when he had such a severe pain on his neck and arm, he could not perform his daily job as a dentist. So I asked him, why? What happened? I checked the pulse, but I know, but I didn't know what happened. Oh, finally, he told me he was a military dentist. So he used to take cold shower every day. So taking a cold shower is a habit. But that day, he caught cold wind after the cold shower. So cold wind into his neck. He couldn't lift his arm. And he was taking the muscle relaxant for 2 weeks. Nothing changed because he's a military doctor. So they give him muscle relaxant supposed to release the tension of the neck, but didn't work. But I gave him 葛根汤 with ma huang. That was time I was in Taiwan. So the pain went away in 2 days. He was so good and so grateful to my Chinese medicine. He told me it's unbelievable. It is. It's no big deal. That's what we do. So 葛根汤, even without ma huang, you can still use for the patient who have neck pain, cold wind or not, for gesture or for twisted neck or for falling off the pillow, causing a lot of pain in the neck and shoulder. In my experience, almost 100% of my daily patients has this problem, the neck and shoulder problem. Sometimes it causes headaches, sometimes cause even the numbness of the leg, of the feet, and also sometimes cause the neck problem, cause the congestion in the chest, and nasal allergy, everything. So frankly, you should put more attention to my pulse diagnosis to the left. I'm sorry, to the right. The right sometimes the right not necessarily like I'm describing now, long and wiry. Sometimes it's like a rainbow or a turtle pulse. The turtle pulse on the right is the neck and shoulder. Okay. So so the point, the area to find the problem of neck and shoulder is here. If it's dark, there's blood stagnation. If it's red, it's inflammation. Then you can use your herbs or your needle treatment accordingly. It works very well. And you see, the neck and shoulder and the chest are on the same level. So they are all connected. So most of the time, the problem in the chest was caused by the problem in the neck and shoulder, not to say the headaches and migraines. Okay. So the first formula I'm introducing to you now is the wind external wing, number one. You should have it mixed and prepared in your pharmacy. You can use it daily. I'm sure you're going to use it almost for everyone, huh? Left one, right hand, left one is not. Okay. So this is the first formula I'm introducing to you. And there's a little problem here. This number and this number. There is something I never spent time talking to you was the proportion and how to prepare the herbs for your patients. And why? I thought everybody should have known that. Everybody, it's so simple. The 35 means, you can say it's 35% or 35 grams, because I myself, I use 150 grams per bottle and give it to my patients. But for the easier for explanation to you for the percentage, so I'm saying we use 100%, 100 grams. So 35 means in one bottle of herbs, this is use 35% or 35 grams. I get 35 grams, so put them all together is 100 grams. And at the end of the day, I will give you a little demonstration, just some pictures, how to mix the herbs and how to advise your patients to take the herb properly and how much dosage should it be. Some people give them, give the patient like 10 grams, 12 grams a day for adult. That's totally useless. We have a certain amount of dosage to give to the patients. We will explain it to you later. Huh? So for now, the 35 means 35% per bottle, and one bottle is 100 grams. Huh? I never thought this was a question until Tina reminded me that hey, some people don't understand what this number means. That's simple. I put them all together to make 100 grams a bottle. So the first 35 is the external. The second condition is astringent, because the nasal congestion, the runny nose and sneezing, and very sensitive to cold surroundings, or in the very sensitive area. I have a patient. She lives in the she lives by a golf course. Wow, the scenery is beautiful, the green grass and mountains, trees. But in golf course, they use a lot of the what do you call it, the bug killers and all those chemicals to maintain the beautiful grass and for killing all those unnecessary bugs. So that stuff made her very sensitive, and all the time, not only the nasal, but the skin always itchy and runny nose, and all the face is red and the eyes are red. Living in that beautiful surrounding, actually, it's like hell to her. So that's the condition we should talk about with the patient and give the patient some advice how to fight against it, since you cannot move out of the area, but so we have something to do to help to stop it, or at least minimize to lowest condition. Okay. So astringent, why do I use astringent? Because the pulse is strong and wiry and forceful. So that means we have fire. When we have fire, we use astringent to put out the fire, to shrink. Astringent is my unique combination. It's very, very useful for a lot of situations, especially for the, let's simply say, fire, heat, expanding. I use expanding to describe this condition, because all the tissues inside are swollen, and the ear signs should be very red and swollen too. So what's the ingredients in the astringent complex? You can check Tina's medicine book on the website or whatever. They have my ingredients in there. This is all sour and bitter medicine. And I use 35%. And the last one is 血府逐瘀汤. That's interesting. 血 means blood. 府 means area. 逐 means expel the stagnation. So 血府逐瘀汤 is the most famous formula in the blood moving as a blood mover. It works somehow it works like aspirin. But anyway, why do I use this? Because whenever there's a fire, congestion, and all the inflammation, swollen tissues, even for common cold, there will be some kind of a blood stagnation. And to help the patient heal faster, I use 30%. But you must ask, or you should discover by yourself if the patient is taking any blood thinners. If they do not use this one. How do you know the patient is some kind of anemic? You can buy, can they see this? By looking at the pericardium 6 channel, this wrist area. If it looks so pale, then this patient might be some kind of anemic. So don't use that. 血府逐瘀汤 is for patients with the darkness in the face, with the darkness in the nose area, in the cheeks, in the mouth, or in the forehead, or the darkness in this area. That means his or her whole body is full of darkness, stagnation. And in addition to using this cold expelling medicine, we also must use some blood mover to get the best results. Okay? Any questions? Shouldn't it be Oh, okay. I am talking about my original pulse signs, but actually the left-hand side is, but I believe most of the people here, most of the doctors here never learned my pulse synergy number 2. So let me just stick to the number 1 on the right-hand side. Okay, let me explain you to. This right-hand side, originally, this is Chun surface, and this is the Chi, neck and shoulder. But in my pulse synergy number 2, this is Tai Yin, this is Shao Yin, and this is Jue Yin. So entire right hand is Yin. And on the contrary, the left hand side, this is Yang. This is Yang Ming. I'm sorry, this is Tai Yang. This is Yang Ming. I'm sorry, this is Tai Yang. And this is Yang, Tai Yang. Dan, this is Dan Jing, and this is Xiao Chang. So this is stomach. A stomach, in number 2, stomach is on the right-hand side, and this is the heart. So it's a little bit different. My number 2 is kind of opposite to my number 1 system. If you're interested, we might give a class next time. But now let's stick to the original, the right-hand side. The right twin is the surface, the lung and everything. And this is Taiyang, the neck and shoulder. You may say it's Dumai, okay? I I moved the stomach from right guan to the left guan. The left guan used to be liver and gallbladder. Now I put stomach to it, like to put yin and yang, two guys, a girl and a boy into one chair to put them together. Why? It's a little paradox. Paradox? No, it's the kind of a thing that happened in the real world because stomach always affected by gallbladder. So next time, if you're treating a stomach problem, do not directly add the stomach on the right hand, usually on the regional right one, but you also put attention to the left one. And you can, if the patient major complaint is stomach, then you should treat stomach problem with gallbladder problem. It might be the channel. So let's put it simple, is 小柴胡汤 case. Okay. Okay. It's a little bit complicated, huh? But this one is for fire, for the real allergy type. With this astringent complex presented, this formula can be so mighty and useful, can do anything with the things in the nasal, stuffy nose, swelling, the nasal inside or whatever, runny nose, runny eyes, running everything, phlegm, everything with astringent complex is so powerful and so useful. You must have it in your clinic. Okay, next one. Oh, haha. Now this is more interesting. In the last page, I want you to take the temperature on the nose and the cheeks, right? Now you must take the temperature in this 10 to runs 22 and the 大椎, the back of the neck. This is 督脉, this is 任脉. Everybody knows that. But even this guy is wearing something with a color. This area is hidden inside the color, but still the temperature can be amazingly cold, low. And most of the time, this area can be hot. And another explanation, the REN 22 point, if it's hot, that's asthma. If it's cold, it's bronchitis. But for this area, must be warm to be able to fight against the cold wind invasion with all the symptoms causing by that. So in this case, we take the temperature here and see if they are different. If the temperature same, warm and same, then we just simply use my previous formula. If the temperature in these two areas is too much different, sometimes it can be 1 degree apart, Celsius. So this even the place, you can try it now for yourself or your patient, your friend next to you. Even this place is covered by color, but still it can be freezing cold. That's unbelievable. Very interesting. If it's freezing cold, that actually, like I said, human face are covered by young meridians and something like that. So it's very strong for the external wind to enter. But the weakest part of a human body is the backside. This is the weakest, vulnerable area to be invaded by the cold wind. So you must keep this warm. But still, even it's on the scarf or under the neck, under the collar by the cold or something, still can be freezing cold. Then you know what to do. You can use a little 四逆汤 or 小柴胡汤 or something warm to bring the circulation here. And then this area will be warmer and all the nasal symptoms will go away. Is that clear? Infancy stage. Yes. Yeah, don't worry about it. What is the person suffered with those chronically? So anyway, you should take the temperature here and here, then to set up your treatment plan. That's very, very important, huh? Okay. That's really funny. But keep in mind that this area is the most weak and vulnerable place. So in wintertime, okay, it's summertime now, but still cold, you must keep this place warm. If the patient comes to you, if you are the patient is sitting next to you, you can use your fingertips or something. If you just feel it, this area, see the temperature here, then you might have an idea of what kind of a problem this patient is suffering, cold or hot. Most of the time, not all the time, sometimes even the pulse is strong and jumpy, still that the body is cold and freezing inside. It's very difficult, very advanced method, advanced approach to find out the coldness. So even sometimes when the patient has a big, strong pulse, I still use 四逆汤 to help with the circulation, especially for arthritis, especially knee joints, arthritis, something like I said earlier in the other classes, when the patient is suffering, okay, for example, this is the knee joints, you should at least use your palm to feel it. If you don't have a temperature gun, you should feel it. If it, two joints, this one is painful, this one is normal. So at least you should feel the painful area, see it's hot or cold, or the normal one is hot or cold. Compare the temperature, that will definitely give you an idea of what herbs to choose from, not by the symptoms. Doctor, I have a knee pain. How are you supposed to use a 普饮 or use astringent or use your warm 独活寄生汤 or blood mover or something? So if it's cold, even other pulse are jumpy fast, then you still need to use 四逆汤 to help the medicine to pass through the little joints. And even because the joints naturally has a very limited blood supply. If you use too much cold anti-inflammatory medicine, the blood cannot bring the medicine to the joint. So even it's hot, you still have to use 四逆汤. Tina, would you explain the 四逆汤 to them? What the heck is in there? Okay.
四逆汤 ingredients. What the heck is in 四逆汤?
Yeah, 四逆汤.
I'm like you, I don't remember the ingredients, but let me check. We have 附子, 干姜, and 甘草. So Dr. Chang,
甘草干姜.
Dr. Chang uses this formula to push the blood to the extremities. Very, very effective.
Okay. Number 2, right sun soup. Oh, this one is interesting. Second type of the allergy is right sun. The superficial and left one is superficial. So this allergy has something to do with the liver. Actually, it has something to do with stomach. Liver heat accumulation. This type of allergy is characterized by symptoms like nasal congestion, yellowish turbid nasal discharge, sore throat, and thirst. There may also be fever and coughing. So fever is very limited, but coughing and the stuffy nose is always commonly seen. So it depends on the patient's symptoms. We use different combination, huh? First is the Qing Fei Tang. Qing means clear. Fei. Fei means lung. So clear. This one 30 for cough, with the cough and phlegm. Or for Qing Xin Yi Qing Fei Yin. Xin Yi also this Qing means clear. I mean the Qing is clear. Fei. Looks like it's the same formula like this one, but actually Xin Yi is a very dispersing hot herb for clearing the nasal, the nasal passage. So this is for nasal allergy. So this one is 30, or this one. It depends on what you like to use. Both are very effective because most of the cough was affected by the backflow from the nasal condition, the stuffy stuff. But major, those things, or this one is a supporting actor. The major leading actor is still my astringent. Astringents for swelling tissues, for the snot. Actually, if you use a flashlight, you can directly see through the nose. Take a look inside the nose. Sometimes you see a little bean, red bean there, swelling, just blocking all the passage. Then you can simply use astringent complex. Astringent complex. But because the pulse is liver, is liver fires, floating liver fire. So naturally, I would use liver detox or not. These two are optional. It depends on which you like. Liver detox also good for skin condition. Allergy problem always combined with skin problems. So put them together. You can choose your 60% of cold medicine. But like I said earlier, sometimes the temperature here are not even, and you might ignore it, or you didn't see it. You didn't have the chance to test the temperature or something there, but naturally this patient will have some imbalanced condition, external wind and internal heat, external coldness or internal heat to causing all this allergy, runny nose, uncomfortable feeling. So 桂柴胡桂枝汤 or 外感, the cold wind #1 is also an optional choice. So sometimes I like use 柴胡桂枝汤 if the patient is weak, skinny, and tired, anemic. But 外感1号 I use it for more strong and people with high blood pressure. That will help to release the pressure of the head. 柴胡桂枝汤 more for weak people, cold people. You can, if you don't have the temperature gun, you can at least feel it, right? So put them together. There are 3 options. You're free to choose anyone according to your personal inspirations, okay? Cause to treat the #2 type of allergy. But that's not all. We have something more. The #3. The #3 is a weak type, very, very weak. Right twin is weak, no jump, no rebound. Yang Wei pulse weak. Yang Wei, you know what Yang Wei is? Is in my 8 extra meridian system, Yang Wei pulse, and weak and scattered. How do you know the weak and scattered? Just take the blood pressure, and by looking at this area, you know, this lady is very anemic or something. The Yang Wei means spleen deficiency. That's in my tie-in, in my pulse energy #2, this tie-in. And dampness retention. According to CM, this type of allergy is often caused by spleen deficiency, leading to dampness retention. Symptoms like nasal congestion, still nasal congestion. So if the patient tells you, "Hey, doctor, I have a nasal congestion," you have to, at least you should find out what type of congestion this patient is suffering from the pulse diagnosis. Clear nasal and fatigue, discharge, poor appetite, and mostly this patient will suffer from loose stools, slight diarrhea. So in this case, there's no doubt we should use something to strengthen it. Otherwise, if it's taking some antibiotics, some aspirin, that won't help, or the allergy pills, the Benadryl, it will help a little, but make the patient more tired and more defenseless. A young weak pulse is deep and weak on the right hand, right cun, actually it's right cun area. Yes. So I use sen mai yin. Sen means produce, mai means pulse. So this one will generate a pulse power 25%. That is combined with ren shen mai dong wei zi. Wei zi is a sour medicine, cold and sour. And not cold, wei zi, wu means 5. Wei means taste or scent. It has, if you choose that wei zi, you find out it's very warm in your mouth. It gives heat, but it's cold, but it's sour. So it's very useful for all kind of weakness in the respiratory system. Oh, the second one, 补中益气汤. I seldom use this because it's dangerous. If you use it properly, it can be very, very helpful. 补中益气汤 brings things up, 生麻 and 柴胡, to bring all your energy to your face, to make your face like a stronger fortress to fight against the cold wind outside. 黄芪健中汤, I do not use this 补中益气汤 very often because sometimes if they have a cough or inflammation or the throat or phlegm, you didn't detect it and use 补中益气汤 will make the symptoms worse. But I use the 黄芪健中汤 pretty often. 黄芪, remember in Chinese medicine book, this is the king of herbs. So that's the most useful thing for strengthening the surface power. 黄芪健中汤. 健 means build up. 中 means in the middle. To give you more energy, but won't cause too much fire to the head. 外感一号, again, 外感一号. So this combination is for weak, tired person, especially, sometimes people with as vegetarian or no exercise, poor appetite, picky about the food, diarrhea all the time. When they have this nasal infection, looks like infection, but really is the response of the whole poor, weak body, then we must do something to strengthen it to help this patient to be able to fight against all the allergy from outside. Interchange. Okay. Any more questions? Okay. And this almost like a most commonly seen condition for allergy types. And for the next, what to tell your patients? We do not just simply give them the medicine. Okay, take it, go home, eat it, drink it. It's not that simple. We should do something to advise the patient to modify or adjust his living condition or eating condition or some other bad habits or something. What should we tell our patients? First, no ice water, no ice cream, no boba tea, no cold drinks. because cold drinks will lower the circulation in the surface and lower the capacity of defense. Secondly, must blow dry the hair after shampoo. And thirdly, should take some vitamin A. Not fish oil, vitamin A. To strengthen the power of the mucus actually is vitamin C, 2,000 milligram, vitamin A, 5,000 international unit. Put them all together, it will help the defense line, make it stronger, to free from the invasion of the cold wind. Okay. Any questions? This is very important, not just give it the medicine. Hey, take the medicine, go home and eat it and come back again. No such thing, They need education. Most of people don't know how to handle their problems. And of course, if it's an allergy, I always ask, do you have any dog in the house? Do you have a cat? A guy told me he has 3 guinea pigs and 4 retrievers. Oh, come on. How can you not get allergy from all those furs and animals? And rabbits bad too. Rabbits always lick their furs and leave their saliva on the furs, that will cause definitely allergy. And I have a patient, a young guy. When I was in Taiwan, he always traveled from Japan to my clinic in Taipei for something for several times. And one day I found out, hey, what's the matter with you? You have such a strange fire and allergy and all the, yeah, he was suffering from runny nose, skin itchy and everything. It's a pure heat condition. Why? Because he moved into a newly decorated house with all new smell and the paint and all the glues in there, because in Japan, they always keep the window closed in the big city and in the building. So that he was poisoned. And those things are very often, I've seen it very frequently, but they call it new house syndrome, whatever. Then that surrounding, you must open up all the window, let all those glue smells out as soon as possible. Otherwise, those things invade into your house, invade in your body, you get poison. How do we know there's a poison pause? Have I ever told you the pause of poison? Right, left. The so-called poison pause is 2 kidney fire plus 1 liver fire. That's poison. Keep it in your mind, 2 long and strong wiry taiyang pulse, we call it kidney fire. 2 long fire kidney pulse, long, extended beyond the chi, and 1 liver fire. Liver is jumpy, floating. Put them together, is poison. Poison what? I don't know. Once I told this to a lady, she said, yes. Oh, I was in the dark room for developing the film, the photos. That was a long time ago with no cell phone, no iPad age. She had some chemicals fell from the cabinet, pour over all her body. All those chemicals for developing films and photos in the dark room. I don't know what the chemicals was, but she had poison. Chemicals, drug, and meds, absolutely. Okay. Let's get on to the next one. Oh, sinusitis. Actually, there's a little bit little bit similar to the allergy condition. Sam, change the film, change the tape. Okay. Let's take a 5-minute break. They have to change the tape.